Obesity can have numerous negative effects on both physical and mental health. Some of the key disadvantages include increased risk of chronic diseases. Obesity is a major risk factor for a variety of serious health conditions, including type 2 diabetes, coronary artery disease, stroke, and certain types of cancer such as breast, colon, and kidney cancer. The excess fat in the body can disrupt hormone levels and metabolism, leading to insulin resistance, high blood pressure, and abnormal lipid levels, all of which contribute to the development of these chronic diseases. Reduced life expectancy. Studies have consistently shown that obesity is associated with a higher risk of premature death. Excess weight increases the likelihood of developing life-threatening conditions at an earlier age, ultimately reducing life expectancy. The risk of mortality from obesity-related diseases such as heart disease and certain cancers is significantly elevated in obese individuals compared to those of normal weight. Joint problems and mobility issues. Carrying excess weight puts significant strain on the joints, particularly in the knees, hips, and lower back. Over time, this can lead to degenerative joint diseases such as osteoarthritis, causing pain, stiffness, and reduced mobility. Obese individuals may also experience difficulty performing everyday activities such as walking, climbing stairs, or standing for extended periods due to joint discomfort and reduced range of motion. Respiratory problems. Obesity can have detrimental effects on respiratory function, leading to conditions such as sleep apnea, obesity hypoventilation syndrome, and asthma. Excess fat around the chest and abdomen can restrict lung expansion and compromise breathing, resulting in symptoms such as shortness of breath, wheezing, and difficulty breathing during sleep. These respiratory issues not only impair quality of life but also increase the risk of serious complications, such as respiratory failure and pulmonary hypertension. Decreased quality of life. The physical limitations and psychological burdens of obesity can significantly diminish overall quality of life. Obese individuals may face challenges in performing routine tasks, participating in recreational activities, and maintaining fulfilling relationships. Chronic pain, fatigue, and emotional distress can detract from enjoyment and satisfaction in life, leading to a diminished sense of well-being and fulfillment. Increased healthcare costs. Obesity places a substantial economic burden on healthcare systems and society as a whole. The management of obesity-related health conditions requires frequent medical visits, diagnostic tests, medications, and surgical interventions, all of which contribute to rising healthcare costs. Additionally, obese individuals are more likely to require emergency care, hospitalization, and long-term medical assistance, further driving up healthcare expenditures and diverting resources away from other areas of healthcare. Reduced fertility. Obesity can negatively impact reproductive health and fertility in both men and women. In women, obesity is associated with hormonal imbalances, menstrual irregularities, and ovulatory dysfunction, leading to difficulties conceiving and an increased risk of infertility. Obese women also face higher rates of pregnancy complications, including gestational diabetes, preeclampsia, and cesarean delivery. In men, obesity can impair sperm quality and erectile function, reducing fertility and increasing the likelihood of infertility. In summary, obesity has far-reaching consequences that extend beyond physical health, impacting various aspects of an individual's well-being and quality of life. Addressing obesity requires a comprehensive approach that addresses both the underlying causes and the associated health complications, emphasizing prevention, early intervention, and multidisciplinary management strategies. Take 5 pieces of jujube, 5 pieces of currant, 5 pieces of cloves, 2 large pieces of cinnamon and 1 large lemon. Take 2 cups of water and add all these things except lemon and cook it. When 1 cup of water is left, strain it. So you can add a little sugar. This is a daily dose. This recipe is to be used continuously for 21 days. Do not eat rice in these 21 days.